Gluteus Maximus muscle, Gluteus Medius muscle, then iliopsoas muscle and adductor muscles. Okay, so all these muscles are present around the hip joint. Okay, and you know the hip is an example of ball and socket joint, and it allows flexion, extension, abduction, adduction, and circumduction. Various movements this hip joint is allowing. Okay, so now when you see this picture, the gluteus maximus is the largest bulk muscle in the body, this gluteus maximus. Underneath to the maximus, you have the medius and gluteus minimus also. So what I will do is, then in the medial side of the thigh, you have the adductor muscles. These are the adductor muscles. Okay, adduction is moving the leg towards the midline. Okay, even in the lower limb also there are deep group muscles and there are superficial group muscles. There are deep group muscles and there are superficial group muscles. Okay, and this is the gluteal region. This is the gluteal region. This is the gluteal region, and you know you use this gluteal region for intramuscular injection. All this area we call it as gluteal region. All this area we call it as the gluteal region. So now, in the clinical point of view, you will give intramuscular injection in this muscle. Okay, this is the gluteus maximus muscle, and it does the extension movement. It does the abduction and extension movement. So this is abduction as well as extension movement of the gluteus. See, you can see this is extension of the hip. This movement is called as extension movement. So these gluteal muscles are supplied by the superior and inferior gluteal nerve. Okay, this is supplied by the inferior gluteal nerve. This nerve is a branch from the sciatic nerve. You see, this is a sciatic nerve, and the branch is going from the sciatic nerve. Okay, inferior gluteal nerve is a nerve supply, and moreover, you see, to give intramuscular injection, you use this region for giving intramuscular injection. Okay, so what you do is whenever you do intramuscular injection, you need to divide this area into 4 quadrants. One, okay, so you have to select this upper outer quadrant for intramuscular injection. This is the area, safe area for you to give intramuscular injection. Okay, see, you may give injection for adult, you may give injection for newborn baby. Okay, so all the injections you have to administer in a safe way that you don't damage any neurovascular structure. You don't damage any neurovascular structure. Suppose in case if you want to give injection here, what you do, there are nerves that you have to consider. This is the nerve that you need to consider. This is the nerve you need to consider. When I remove this, you see the sciatic nerve is passing in the deeper aspect. This is the sciatic nerve that is passing in the deeper aspect. So you select the upper outer quadrant of the gluteal region for intramuscular injection. In case when you damage this sciatic nerve, it is going to affect the complete leg. You see, this sciatic nerve starts here in the greater sciatic notch and comes all the way down in the posterior aspect of the thigh. You can see it clearly here. In the posterior aspect of the thigh, it is this sciatic nerve is coming. And this nerve is passing in the posterior aspect of the thigh, and in the knee level, in the popliteal fossa, it is bifurcating, and then this nerve is supplying all the branches. I mean, these various branches are supplying all the muscles of the leg. So, if this nerve is damaged here in the starting area, then all these muscles that is present in the leg are going to be paralyzed. You know, when the muscle is paralyzed, it's not going to work properly. When the muscle is paralyzed, it's not going to work properly. So you need to take care of this nerve when you give intramuscular injection in the gluteal region. Okay, don't come to the middle of the gluteal region, just select the upper outer quadrant. Okay, then moreover, deeper to that, deeper to this gluteus maximus muscle, you have this other muscles, that is the quadratus femoris, and this is the gluteus medius muscle, and inner to that you have gluteus minimus muscle. Okay, all these muscles are doing the function of extension and abduction of the hip. Okay, then between this sacrum and this area is the greater trochanter. This area is the greater trochanter and this is the sacrum. Between the sacrum and the greater trochanter, there is a small muscle called as piriformis. This muscle is called as piriformis. So whenever there is a spasm of this piriformis muscle, it is going to compress the sciatic nerve underneath. It is going to compress the sciatic nerve underneath. So when this sciatic nerve is compressed, it is going to have a radiating pain all the way down. It is going to have the radiating pain all the way down. Okay. So when there is piriformis spasm, it is going to, clinically, when the nerve is compressed in a point, wherever the nerve distributes, there is radiating pain. For example, if the nerve is compressed here, all this area there will be radiating pain. We call it radiculopathy. We call it as radiculopathy. We call this as radiculopathy. Okay. So now, in case if this nerve root is compressed due to the disc issue here in the L2 or L1 vertebra, then also there is radiating pain. So generally patients with the lumbar spondylosis, they complain of pain radiating in the backside of the thigh and then to the leg. Okay, so you have to understand the nature of the pain. Okay, so whether the pain is of radiating nature, that means what, there is some issue with the there is some issue with the radiating, issue with the nerve root. Okay, so there may be some compression. So in that way, if this piriformis muscle is compressing the nerve, then also there is radiating pain. So now this is what we call, you can Google it. We call it as Piriformis Syndrome. We call it as Piriformis Syndrome. Okay. So this piriformis, okay, when you remove the spasm of this muscle, then the pain will be relieved. Okay. So there are many clinical aspects that you have to understand. Okay. So now these are the important muscles that is present in the gluteal region. Okay. This is the important muscle that is present with the gluteal region. Okay. Now come to the muscles of the adduction of the thigh. Okay. So these muscles are present in the medial aspect of the thigh. To show the muscle function, it's better I remove the anterior thigh muscle. Okay. For your better understanding, I will remove the muscles that are present in the anterior aspect of the thigh, so that it will be easy for you to understand. Okay, these are the muscles. Okay, even the posterior muscles, I will remove it. Posterior muscles of the thigh. These are the posterior muscles of the thigh. Okay, so now when you see here, what you see here is these are the muscles that are present in the medial aspect of the thigh, and this muscle is called as gracilis. So what you have to observe here is this muscle starts in the pubic ramus and comes all the way up to the medial aspect of the tibia, So we can call it as, I think there is another name for this muscle. It's called as the Rapist Muscle. Okay, you can Google it. The other name for this muscle is called as the Rapist muscle. Okay, So this is one muscle present in the middle aspect of. And apart from these, there are three muscles. That is adductor. This is the adductor magnus, and this is the adductor longus, and this muscle is the adductor brevis. All these adductor muscles are innervated by the obturator nerve. Okay, are innervated by the obturator. You see, this obturator nerve is starting in the lumbar plexus, and then it is coming all the way through the obturator canal. Okay. So you see, this is obturator foramen. Okay, through this obturator foramen, the obturator nerve comes and supplies the muscles that is present in the medial aspect of the thigh, and supplies the muscle that is present in the medial aspect of the thigh. Okay, so this is obturator magnus, this is adductor magnus, and this is the adductor longus, and this is adductor brevis, and there is another small muscle called as pectineus. Okay, so these are the muscles you have to know that is present in the medial aspect of the thigh, and when they contract, when these muscles contract, they do adduction movement. This is the adduction movement. So moving the leg towards the midline, we call it as adduction. Okay, so this is a muscle that is doing the adduction movement. Okay, now we will go to the muscles that is present in the anterior aspect of the thigh. So better I keep all the muscles back, and then okay, muscles of the anterior thigh are innervated by the femoral nerve. Muscles of the anterior thigh are innervated by the femoral nerve. Muscles of the anterior thigh are innervated by the femoral nerve. Okay, so this femoral nerve I want to show you. Okay, just see. Okay, you see, the femoral nerve starts in the lumbar region. The femoral nerve starts in the lumbar region. So this nerve comes all the way and to the inguinal canal. This nerve comes out through, then it is supplying, distributing to the anterior aspect of the thigh. So all the muscles that is present in the anterior aspect of the thigh are supplied by the femoral nerve. So there is one long muscle in the body. This is the Satorius, which is said to be the longest muscle in the body in the anterior superior leg spine, and it is coming all the way down to the medial aspect of the tibia. It is coming all the way down to the medial aspect of the tibia. All the muscles that is present in the anterior aspect of the thigh, they are helping with the extension of the knee as well as flexion of the hip region. Okay, now when you see this is the yes, this function is the extension of the knee. This function is the extension of the knee. So when the knee extends, the quadriceps in the anterior aspect of the thigh contracts, and it is pulling this tibia so that the knee will extend. Okay, and if you have to understand this muscle, see, there are four muscles. Okay, collectively we call them as quadriceps. Quad means four. Quad means four. We call them as quadriceps. Okay, so one is the rectus femoris, the muscle that is present in the anterior aspect of the thigh. Then you have the vastus medialis that is present in the medial aspect. Then you have the vastus intermedius between the vastus medialis and lateralis. Then you have the vastus lateralis. All these four muscles are called as quadriceps muscle. All these four muscles are called as the quadriceps muscle. Okay, then coming to the muscle that is present in the posterior aspect of the thigh. Okay, all these three muscles are called as the hamstring muscles. All these muscles are called as hamstring muscle. here you can this muscle is responsible for flexion of the knee. This muscle is responsible for flexion of the knee. Okay, this muscle is responsible for the flexion of the knee. So apart from this, there are other function also, I will tell you. So this hamstring muscle consists of three parts. One is the biceps femoris. This means the tendon is coming in the lateral aspect of the knee. See, in the knee, this area is called as a popliteal fossa. This area is called as the popliteal fossa. This area is called as the popliteal fossa. Okay, then in the lateral aspect of the knee, if you feel, you can see one tendon. You can see one tendon, and in the medial aspect of the knee, you can see one semi-membranous and semi-tendinous tendon. Okay, there are two muscles that is coming in the medial aspect of the knee. One is semi-tendinous and other is the semi-membranous tendon. Okay, and in the lateral aspect of the knee, you have this tendon of the biceps femoris. So all these three muscles, that is the biceps femoris, the semi-membranous muscle and the semi-tendinous muscle. This is semi-membranous and this is semi-tendinous muscle. All these three muscles are collectively called as hamstring muscle. All these three muscles are collectively called as the hamstring muscle. Okay, so now I will remove this, and these muscles are innervated by the sciatic nerve. Okay, you can see the sciatic nerve that is passing in the posterior aspect of the thigh is supplying the muscles of the posterior aspect of the thigh. Is supplying the muscles the posterior aspect of the thigh. Okay, so I will remove this. I will remove this muscle that is present in the posterior aspect of the thigh. So now you know the muscles of the extensor of the knee in the anterior aspect, muscles of the flexor of the knee that is present in the posterior aspect, and muscles of the knee, the medial aspect of the thigh that is responsible for adduction movement. That is responsible for adduction movement. Okay, then okay, now in the lateral aspect there is the muscle called as tensor fascia lata muscle. What is the tensor fascia lata? This muscle originates in the iliac crest here. This is the muscle that's originating. It is changing into a flat aponeurosis. It is changing into a flat aponeurosis, and then it is coming down as a flat aponeurosis and taking the name as the iliotibial tract. And it is taking the name as the iliotibial tract. Okay, you see, this is the adductor tubercle of the femur. This area is the adductor. This area is adductor tubercle of the femur. This area is adductor tubercle of the femur. Okay. Now what happens when the knee flex? When the knee flex, you can see here. You see, when the knee is flexing, this adductor, that IT band, iliotibial band, is passing through this. Okay, so this iliotibial band has continuous friction with this adductor tubercle, and it causes severe amount of pain, especially for the people who are jogging daily. We call them athletes. Okay, for when they are okay, here you can see. Okay, see, whenever the knee is flexing, you can see this IT band is rubbing with the adductor tubercle, and finally it gives severe amount of pain in the lateral aspect of the knee joint. Okay, this is one of the clinical point. We call it as IT band syndrome, iliotibial band syndrome. We call it as iliotibial band syndrome. Okay, what you see here is the muscle muscles that is present in the leg region have to work in the knee as well as in the ankle joint as well as in stabilizing the foot muscles. Okay, I mean align this foot bones. Okay, so we will come from the beginning. So if you look at the muscles in the leg, this is the anterior side and this is the posterior side. Okay, so there are muscles that is present in the anterolateral aspect and there are muscles that is present in the posterior aspect. There are muscles that is present in the posterior aspect of the leg. Okay, so here when you see here, when you look at the muscles of the anterior lateral aspect of the leg, you have this tibialis anterior, then extensor digitorum longus and extensor hallucis longus. Okay, now these muscles they are acting in the ankle joint and they do the extension function. The extension function of the ankle joint is also called as dorsiflexion. The extension function, this extension function of the ankle joint and is also called as dorsiflexion, and this movement is extension of this great toes. Okay, this movement, this is extension, this is extension. So when you observe here carefully, there is extensor retinaculum. There are band of tissues. There are band of tissues. If you look at the connective tissue here, this mechanism is really okay. Yeah, see here, these are the extensor retinaculum. This is called as extensor retinaculum. So the tibialis anterior muscle 5 tendon that comes through the extensor retinaculum and inserts here in, yeah, this is the base of the metatarsal. Okay, this tibialis anterior tendon comes all the way and inserts the base of the metatarsal. So once this muscle contracts, your leg will go in for dorsiflexion. Okay, your leg is going for dorsiflexion. Now this is the muscle that is present in the anterior aspect of the tibia. Now I will remove that. Then again you have the extensor digitorum longus muscle. Okay, see the name extensor means it does the extension movement. Digitorum means it is coming to the digits. Okay, these are all the digits. Okay, then longus, that means what? The muscle tendons are very long, so that is why it's called as extensor digitorum longus, and they do the function of extension of this digits. Okay, this is great toe, second toe, third toe, fourth toe, fifth toe. Okay, you see this extensor digitorum longus muscle is not present in the great toe. It is present only for the second, third, fourth, fifth toes. This is what you have to observe here. Okay, I will remove that. Then apart from this, you have the extensor hallucis longus. Hallux means great toe. Okay, note down this. Hallux means great toe, and here it is extending only the great toe. It is extending only the great toe. It is extending only the great toe. Okay, it is extending only the great toe. Why I am telling all these tendons passing here? Because students, if you see, even this kind of tendon arrangement is same in the hand also. Okay, so people come with cut injuries to your clinic, like laceration in the skin in the hand or in the foot. That time, before you suture the skin laceration, you need to check all this tendon whether they are intact or not. So what you have to do, with the wound in place, you have to ask the patients to do this extension movement. So that time when the tendon is cut, the movement will be absent, respective movement will be absent. So you need to observe all these things, and then only you have to go for suturing. In case if you see any tendon is cut, then you need to refer the patient to plastic surgery department. You need to refer the patient to plastic surgery department. Okay, so this is extensor hallucis longus muscle. Okay, now the anterolateral muscles are over. Now we will go to the posterior muscles. Posterior muscles. Okay, this muscle that you see in the posterior aspect of the leg is called as the calf muscle. Is called as the calf muscle. So this calf muscle consists of two parts. One is the gastrocnemius, and deeper to that you have the soleus. So these two muscles join together to form a single tendon that is called as the Achilles tendon. That is called as the Achilles tendon. Okay, so now this is the gastrocnemius muscle. Okay, this muscle has the lateral head and the medial head. This muscle has the lateral head and the medial head. Okay, so I will remove this gastrocnemius, and inside deep to that you see the soleus muscle. Okay, this is the soleus muscle. You see, this soleus muscle is special. Why? Because some book they call this soleus muscle as a peripheral heart. They call this soleus muscle as peripheral heart. I will tell you why. You see, there are deep veins in the leg. There are superficial vein and there are deep veins, isn't it? Yes or no? So you can see here. These are the deep veins. These are the deep veins, the posterior tibial veins, the fibular vein. These are the veins present in the deeper aspect. Okay, so and this is a superficial vein. This is the superficial vein. You see here, the superficial veins present in the superficial aspect. The superficial veins, they are present in the superficial aspect. Okay, this vein is a small saphenous and this is a long saphenous. Okay, it's also called as great saphenous or medial saphenous. Okay, both these veins are present in the superficial aspect. Both these veins are present in the superficial aspect. But deeper to that, you have this. Okay. Okay. You see. So why I am giving so much importance for this? Because these deep veins passes through this soleus muscle. This deep vein is passing through this soleus muscle. Okay. So whenever you stand or whenever you walk, the contraction of the soleus muscle is pushing the venous blood up. The venous blood goes here to the popliteal vein, then to the femoral vein, and then to the inferior vena cava. So what happens when the patient becomes bedridden, or when you are admitting the patient to the bed and the patient lies down the bed for 2 days, 3 days, 1 week? What happens? The soleus muscle contraction is absent and the blood stays in the deep veins and it clots. So this condition is called as deep venous thrombosis. Okay, if you are a nursing student, you are responsible for this incident. Okay, what will happen if there is a deep vein thrombosis? The blood clots inside this vein. When suddenly the patient starts to move, the clot will detach and it will go to the inferior vena cava. From inferior vena cava, it will go to right atrium. From right atrium to right ventricle. From right ventricle to the lungs. There, these clots go on block and cause pulmonary embolism. That condition is called as pulmonary embolism. Immediately the patient will start to have dyspnea, that is difficulty in breathing, and the patient will die. So this cause of the death is DVT with PE, that is deep venous thrombosis with pulmonary embolism. So as a nurse, you have to make sure that you keep this muscle contracting. So you have to ask the patient to do physical activity regularly every 30 minutes. Okay, if they are unable to walk, at least they can move the ankle and you can press the soleus muscle, massage the soleus muscle and push the venous blood up. Okay, this is how you are going to save the patient life. So the deep vein that is running through the soleus muscle is very important. Okay, that is why the soleus muscle is called as the peripheral heart. That's why the soleus muscle is called as the peripheral heart. Okay, both this gastrocnemius muscle and the soleus muscle comes down. Both these gastrocnemius muscles and the soleus muscle comes down and form one strongest tendon in the body, that's called as Achilles tendon, also called as tendocalcaneum calcaneus. Why it is called as calcaneus tendon? Because this is a calcaneum bone, okay, and the tendon is inserting in this calcaneum. Calcaneum. Okay, that's why it's called as tendocalcaneum or Achilles tendon. Achilles tendon. This tendon is said to be the strongest tendon in the human body. It is said to be the strongest tendon in the human body, and when you walk, this muscle has to contract. So if this tendon is cut, you cannot stand. Your ankle joint will bend forward and you will fall down. So this tendon is very important for standing, for walking, for all these things. In sports injury, if this tendon is cut, the person is in the bed. Okay, he cannot stand anymore. All right. So know the importance of this Achilles tendon. Okay. So now I will remove this all these muscles that I explained now. Okay, this is gastrocnemius and the soleus tendon. All right. Now, in the deeper aspect and in the lateral deeper aspect, there are some muscles. There are some muscles in the deeper aspect. Okay. So these muscles, they take the tendon all the way down to the foot, all the way down to the foot. Okay. So here, if you see, this is the tibialis posterior tendon. This is the tibialis posterior tendon, and this tendon is coming all the way to the base of the metatarsal here. So this is tibialis anterior tendon and this is tibialis posterior tendon. Okay, and it does the function of inversion. See, this movement is called as inversion of the ankle joint. Okay, whereas the opposite side movement we call it as eversion. We call that as eversion. Okay, now I will remove that muscle and finally we will go for flexor digitorum. See this tendon, flexor digitorum tendon, it comes all the way posterior side and this tendon is going to all the digits. And these tendons are going to all the digits. Okay, and it does the function of flexion of all the toes. You see, this is the function of the flexor digitorum muscles. It flexes all these digits. It flexes all these digits. All right, I will remove that. Then there are some okay, this one is flexor hallucis longus. Like you had extensor hallucis, that is to the great toe, and this muscle is also going to the base of the great toe, only to the great toe, only to great toe. Okay, this is called as flexor hallucis longus muscle. This is called a flexor hallucis longus muscle. Okay, and now there are some aorta muscles. You have to observe this tendon here. Okay, see this fibularis longus muscle is also called as peroneus longus. Some they call it as peroneus longus. Okay, don't get confused. So this is the fibularis longus muscle, and this is the fibularis brevis muscle. All this one, and this is the fibularis tertius. So fibularis longus, brevis and tertius. That is peroneus longus, brevis and tertius. All these three muscles does the function of eversion. Okay, does the function of eversion. So this is eversion of the ankle joint. This movement is called as eversion of ankle joint. Okay, so these are present in the lateral aspect. These are present in the lateral aspect, and they are getting the origin from the fibula bone. They are getting the origin from the fibula bone. Okay, so these are the muscles that you have to see in the posterior aspect of the leg. Okay, now what you are seeing down is the muscles of the foot, muscles of the foot. Okay, so now you see this is the inferior aspect of the foot, and here you see what you have to observe here is this arch. Okay, now you see this is the medial arch of the foot, and this is the lateral arch of the foot. The medial arch and the lateral arch, and the lateral arch. Okay, so this arch is maintained by the alignment of this foot bone. See, there are 7 tarsal bones: calcaneum, talus, navicular, cuboid, medial cuneiform, intermediate cuneiform, and the lateral cuneiform, and 5 metatarsals and 14 phalanges. Okay, all these bones are present in the foot here. All these bones are present in the foot here, and these muscles that is present in the base of the foot, muscles that is present in the base of the foot are helpful in maintaining the arch. Okay, if this muscle gets paralyzed, then the arch collapse. Okay, this is the Flexor Digitorum brevis muscle, and this is the Adductor hallucis muscle, and this is the Adductor digiti minimi muscle, and this is the Quadriceps plantae muscle, and these are all the Flexor hallucis brevis muscle, and these are the lumbrical muscles. Lumbricals means they are attached to the bone as well as they are supporting the tendon to give stability. Okay, so and this is the intraosseous muscle that is present between the metatarsals, that is present in the between the metatarsals. Apart from this, what you have to observe is this connective tissue fascia. Connective tissue fascia. Okay, so this is the plantar fascia. This is the plantar fascia. Okay, you see, this is the plantar fascia. We call it as plantar aponeurosis. Okay, this fascia is acting like a spring to prevent the collapse of this arch. To prevent the collapse of this arch. Okay, so this plantar aponeurosis is very important clinically because when the inflammation starts in the connective tissue, it leads to continuous severe amount of pain. So when the patient comes to clinic with foot pain, you have to press these plantar aponeurosis and see whether there is any inflammation, or the calcaneum will grow like a spur. So if you type in the Google calcaneal spur, you can see a thorn-like growth in the bones in this region. Okay, that's called as calcaneal spur. That spur will be piercing this plantar fascia, and it will be causing severe amount of pain. So patient comes to the clinic and they have severe tenderness here. Take an X-ray and see if there is any thorn growth, that is calcaneal spur. If there is no calcaneal spur, then there can be inflammation of this plantar fascia, or there can be micro tear that can take place in the plantar fascia that gives severe amount of pain in the base of the foot. Okay, so this is the importance of connective tissue that you have to understand in the base of the foot. Okay,